Is your aesthetic provider truly an expert and someone who you can trust your precious face with? After watching this video, you'll learn 3 questions that you can ask your provider to ensure that they're at the top of their game, highly trained, and worthy of your trust for your beautiful, perfect skin and in this person's hands. Because without the right training and without knowing what questions to ask your provider, many people can appear as experts on Instagram or on social media when in fact they're not. You'll be so amazed when you find out the embellishment of credentials, false advertising, and false credentialing that many physicians and providers are putting out there these days, and having patients fall into the traps of complications, less than desirable outcomes, and deleterious outcomes from these providers who they're trusting their face with, who should not be deserving of their trust. Watch this video, know what 3 key questions to ask, and you're not gonna find this anywhere else, because as a physician, when I'm interviewing other physicians or providers, these are the questions that I know what to ask. And as you, as a patient asking these questions, you'll be foolproof and not putting your hands into someone who doesn't deserve your trust. All right, you guys, hope you enjoy. What to look for in a provider. How do you find a provider you can trust? How do you know if your injector is an expert or not? These are questions that a lot of my patients have when trying to find a new provider or trying to instill trust in someone with their skin, especially on their face. So after a conversation I had with a patient yesterday, it prompted me to make this video for you guys. And it's just off the cuff, and this is completely authentic, but I feel like I could give you 3 ideas and 3 questions to ask your provider, which you will know in 50 seconds whether this person is an expert or not. So it all happened yesterday when I saw a patient, and she came in for Botox in her glabella. The glabella is like the 11 lines right here. And she said, "Dr. Capel, I couldn't get in to see you, so I went somewhere else, and it made my forehead lines worse." She goes, "How can Botox make your forehead lines worse?" And she goes, "I went to her a couple times, and every time it happens. And then when I come to you, it doesn't happen." And she said that the provider said, "Well, there's a new way to inject Botox and an old way to inject Botox, and I don't do the old way, I just do the new way." And the bottom line is there's no old way or new way to inject Botox. When we were learning as young physicians on how to inject Botox, it was also complemented by doing anatomy labs where you're dissecting cadavers and dissecting people's faces. Also, decades of me being a skin cancer surgeon and opening up the face and seeing the muscles. I have an appreciation, and most dermatologists and plastic surgeons will have an appreciation for not only your facial anatomy, but the variations in muscles and facial anatomy that occur from patient to patient. So when I see a patient and I'm injecting Botox, I'm not like memorizing dots that are being drawn like you do it here, here, and here. Or for crow's feet, you go here, here, here. If you look on Instagram, there's these things, these reels where you're teaching people how to do Botox, and it's like the blind leading the blind. You should never memorize. And for you young injectors out there who are just starting in your practice, don't memorize patterns for Botox, because not every patient reads a textbook. Not every patient's muscles are exactly as they are in your anatomy textbooks. And so that's why whenever I treat patients, I don't look at what we did last time. I want to see them at that point in time, because they may have Botox from somewhere else that is partially kicked in, or who knows what. And at every given state of time, you have to assess the patient, how they're moving, where their muscles are pulling, how they're contracting, how when you inject those muscles, how the other muscles are going to compensate or overcompensate. And that's how you do it. There's no old school way or new school way, or this is a new way to do Botox. Every patient should be different, and you should not be doing the same thing on every patient. I can't emphasize that enough. So my patient was saying, "Well, she called herself an expert injector." And I'm like, "Well, what does that mean? Like, who's an expert injector?" We can all say we're expert injectors. Now, I do think that with time, people get better at being injectors. I've been doing this almost 20 years, and I feel like, you know, I'm on my A game now, and I've learned a lot along the way. But I do feel like if you really wanted a question you can ask your provider, and people are gonna probably get mad at me for telling you guys this, but as patients, my job is to empower you, you know, on your side, and I want you to have the best treatment possible by the most highly trained individuals who are touching your precious face. So these are the questions you can ask. Sometimes say you're going in for something simple. These are the most standard areas of Botox: crow's feet, glabella, forehead lines. But say you want to treat something more off-label or a little bit more tricky, or an injection site that requires a little bit more skill or technique. I would say, go in and say, "Yeah, I'm here for my glabella, but also, what do you think about doing jelly roll Botox," which is this area right under the eye, or the bunny lines, or the Tinkerbell nose, where you do Botox at the bottom of the columella, and it upticks the nose, so you have a little Tinkerbell upturned nose, or the DAOs, the depressor anguli oris muscle that pulls down. These are areas that are a little bit more risky and tricky and require a higher level of skill. And so if you want to see if your provider is a true expert, you can say, hey, can you do my DAOs? And if they're like, oh no, that's off label, that's not going to look good on you, or that's not a good one, then question their credentials and their level of training. So that's kind of like a little sneaky way that I've told my patients, if you're gonna go somewhere else, which is totally fine, I know I'm booked out and sometimes it's hard to see me, ask your provider, hey, are you comfortable treating these areas? And if they're not, they may tell you, oh, it's off label, or it's not good for you, or it's not an area that we treat. That's kind of the telltale sign you should probably run out the door. That's a red flag that they're not comfortable doing it. And that's how you can tell the experts from the non-experts, to be completely honest with you guys. Okay, hack number 2, how you can see if your expert provider is really an expert. Now this is in the laser category. If a doctor tells you, because of your skin tone, skin of color, you're not a candidate for laser, that is complete bullshit. If somebody tells you you're not a candidate to because of laser because of your skin color, or because you're a Fitzpatrick 3, 4, 5, or 6, run out the door. You probably don't want that person treating you with laser anyway. Part of my advanced laser fellowship training after I completed my dermatology residency was treating skin of color. It absolutely can be done. Does it require higher level skill? Yes. But if you don't have that skill as a provider, I feel it's highly unethical to tell a person a skin of color that they're not a candidate for laser just because you personally can't treat them with laser. So this is like a PSA for all you guys out there. Providers, don't do this to your patients. If it's out of your wheelhouse and out of your scope of practice, refer them to someone who can help them, can safely treat them with lasers, regardless of their skin color. Now, if you're a patient and somebody tells you you're not a candidate for laser because of your dark skin, run out the door. You don't want to be having that provider treating you anyway. I can't say that enough. With the right laser, the right parameters, the right pre and post care, we treat skin of all color with lasers safely and effectively with amazing results. Is it going to be the same for every person? Absolutely not, but that's where the level of training comes in. When you're trying to select the correct laser parameters, which wavelength, how many passes, which different combination of lasers, the pre-care, the aftercare, it's really important, but absolutely it can be done. There's nobody who's not a candidate for laser based on their skin type or their skin color. I had a patient come in who was a beautiful African-American woman who had melasma, pretty significant melasma on her cheek, who had been walking around with it for 15 years because she had been told that she was not a candidate for laser. I did maybe 3 sessions of a certain laser with appropriate aftercare, and she can run around. She has the most beautiful skin, I think, of anybody in my practice. Gorgeous skin of color. Her melanin is evenly distributed in her skin. And she's like, doctor, I cannot believe I went 15 years without this because I was told by a couple different providers, not a lot, but like 2 or 3 providers that I wasn't a candidate, it would make it worse. So that just absolutely breaks my heart. And so if anybody out there is watching this, yeah, that's just something that's fear-mongering, and that's also not taking accountability as a laser specialist, saying that something can't be done when you personally are the one that just can't perform that, and that's just highly unfair to patients. Okay, I'm very passionate about that, especially for my patients with skin of color. Okay, next topic, number 3, periorbital laser treatments. So periorbital just means like around the eyes, right? You can do energy-based devices, different lasers. You have to insert eye shields in order to treat around the eye area. Now, it's true, in certain cases you can't use certain lasers around the eyes, but for most lasers, I don't care if you're talking about a clear and brilliant, a Fraxel, a CO2, an erbium, ablative, non-ablative, fractionated, non-fractionated, full field. You can use most lasers around the eyes. It includes the treatment must have an insertion of an eye shield, which takes a higher level of skill. You have to put some numbing drops in the eyes. You have to understand how to put the eye shields in. Even when inserting eye shields, there could be complications. You have to know how to manage the complications, who to send the patient to. If there is a complication, God forbid there's not, there's different eye shields used for different devices. For example, you use metal eye shields when you're doing lasers. Again, this is not a medical lecture for any of you guys, or this is by no means a teaching video. I just want to show you guys, the level of skill and knowledge that it takes in order to treat around the eye skin. The metal shields used in lasers is not the same metal shields you would use with a thermage. You use plastic eye shields for thermage. You would not want to use the plastic eye shields for a laser. You would fry the eyeball, maybe cause blindness, horrible, horrible side effects. But it takes a lot of education and training to not only know what type of eye shield to use, but what lasers can be used safely and effectively in the right settings, and how to treat that delicate eyelid skin differently than other areas of the body, including the face. That is a non-periorbital skin on the face. So I think what I'm saying is, if you're seeing a laser surgeon or a laser specialist, or if you're in a med spa and somebody's recommending laser and you say, hey, can you treat under my eyes? Can you do CO2 under my eyes? Or can you do, thermage of my upper eyelids? And they're like, oh no, we just don't do that. That's not safe. It's not indicated. That's complete bullshit also. That means that they're not trained to do it. And now there may be patients who I see who they're not a candidate for a certain type of periorbital treatment for one reason or another. But I do treat many patients around their eyes. Eyelid skin is probably the most common area that I treat because this is the first area to show our age. It's the thinnest skin on our face, and it's the first to go as we get older and gain wisdom and have birthdays. We do it all day long, but a lot of patients will say, oh, I'll do the laser, and the laser person only treated like my skin around my eyes and they didn't treat around my eyes. That's a telltale sign that they didn't have appropriate laser fellowship training. And in my opinion, that's kind of like a hack that you can do to see if your laser specialist is a laser expert. There's no laser expert who's going to say, no, we can't treat under the eyes. It's not indicated, or no, we just don't treat the eyelids. If they're highly trained, they're going to be able to treat your eyelids safely, effectively, with confidence, with the best results. So ask for Botox, those off-label areas that we talked about. Ask for, if you're having a laser, say, hey, can you treat the skin around my eye? If they say no, they're probably not highly trained enough for you to trust your delicate, precious facial skin with. And if you're a darker skin tone, Fitzpatrick 3, 4, 5, 6, and you're told by a laser specialist or a provider that you're not a candidate for laser, then don't go back to that place. You wouldn't want to be seeing that laser person anyway. So those are the 3 questions. If you kind of want my little hack to kind of weed out the real deals from the non-real deals, the experts from the non-experts who are pretending to be experts, that's what you can ask. So hopefully this empowers you guys, and I hope you find this useful. I am here for any questions or comments, and my service is to provide this educational information and empowering patients in a world and a field that's completely flooded with, just horrible things happening out there. So this comes from the heart. I love you guys. See you next week. Okay, you guys, I hope you enjoyed this video, and now you know what to ask your provider. And if you have any questions, feel free to ask in the comment section. And I hope this provided insight for you. I hope this didn't make anybody mad who doesn't have these credentials or who's going to have their business hurt by these questions being asked by their patients. But in the end of the day, patient satisfaction, patient care, and patient outcomes and patient safety is the utmost importance for any provider above everything and everything. So you'd be amazed at how many plastic surgeons or even board certified dermatologists are they themselves not doing the procedures, but having extenders do these procedures who are less than desirably or highly trained and can get you in a bad position if you're not careful. So hopefully this will educate you, empower you, and protect you from bad outcomes and less than desirable results. All right, as always, you guys, I'm here for you and I love you. Thank you so much for watching. Drop a comment in the comment section and share this video with someone who may find it useful. As always, I love you guys.